So in the video I'm going to show today, we're going to be treating plantar fasciitis. It's a condition that affects the very base of the foot here. It's that fascia that wraps and attaches here and wraps all the way to the end of your foot. Oftentimes it's treated by stretching out the fascia and doing a lot of stretches like this and stretching out your gastroc and your Achilles tendon. My treatment's a little bit different. I approach it by working on and strengthening this muscle that attaches to the large toe, very similar to treatments for bunions. And part of that treatment is actually going to the base of the foot and breaking up some of that tissue, and you'll see that in the video. But mostly it's working on training the patient to do some foot exercises to strengthen all the intrinsic muscles of the foot, stretching out the muscles on the very top of the foot, and also stretching out this muscle here. And what I'm really focused on doing is trying to get as much of an arch in this medial area of your foot so that the muscle that wraps from here and then goes to the very edge of your large toe doesn't strangle the blood supply that's coming from an artery that goes from the inner part of your foot and wraps around and supplies that plantar fascia. When you have a flatter foot, it stretches that muscle out so much so that it's actually closing off that blood supply. And instead of inflamed tissue, which is the early stages of plantar fasciitis, the tissue actually becomes dead. And so it's fairly useless going into dead tissue and trying to stimulate that. You really just want to bring out the strength of the intrinsic muscles in the foot. So most of my treatment is focused on exercises and just some mild adjusting of the feet to encourage and facilitate building the arch. I'm trying to get right onto the base of the foot and right in the area where this muscle that goes from here all the way up through here is restricting the flow of blood coming through this artery based on the types of shoes you're wearing. Usually the shoes tilt your toe in like this, which tightens this muscle, and it creates a dead spot of blood flow. It just strangles out this area.
So many techniques we're working on that.
Uh-oh. It's getting close.
So I want you to press up into my hand. Perfect. Hold, 2, 3, 4, 5, and now relax. Okay. Now press up again. It is on. So bring it to here. And now separate them. Okay. And then into here again. And separate. Push your big toe down. Standing on